Here are the 7 top concerns our patients have when it comes to embarking on a CO2 laser journey. So the number one is pain and discomfort. So CO2 lasers have been around a very long time. So the first laser was done at about 1974. That was the first dermatological CO2 laser done. And we used to do something called full field ablation. So I'm going to explain what that is. You have your epidermis, that is the top layer of the skin. That is the layer that gets sunburned, or if you do an exfoliation, you'll remove the top layer of those skin cells. Then you have the dermis here, okay? And you've got some stem cells in there, your hair follicles will come down in here as well. And the further deeper you go down into there, if you come right down here, you'll cause a scarring when you cause a damage. But up here, the skin will resurface really nicely without a scar and look really beautiful. So we used to use that to take off the entire top layer of the skin, and then your body would regenerate that top layer and it would look amazing. It would like fully resurface the skin. The downside for that is you need that top layer to keep all the good stuff in. So you get a lot of oozing and bleeding and crusting. The other thing you need that layer for is to keep out pathogens, to keep out bacterias and funguses and those kind of things. So you get infections afterwards pretty commonly. How we do it now though, and this is how we've managed to reduce a lot of the discomfort associated with the procedure, is that we do a fractional delivery of the energy. So instead of treating the entire skin, we only treat a fraction of the skin at once. So instead of doing 100%, we do anywhere from say 2% to 40%, depending on how aggressive we want to be. And then we leave healthy islands of skin here that allows the skin cells to migrate down and heal that controlled micro damage really beautifully. So that results in far less discomfort than taking your entire skin layer off. The other ways that we can help to reduce the discomfort associated with the procedure is with having a cooling tip. So we make the skin quite cold before we deliver the energy. Cold and pain travel through the same nerve. So it kind of tells the brain that things aren't as painful as they are. The other thing we do is a really strong numbing cream. So different to a lot of the other clinics out there, we are a doctor-led clinic. We have doctors in every clinic, which allows us to perform or deliver a prescription grade topical numbing. So we leave that on for about 30 minutes, maybe slightly longer, depending on the individual circumstances, to make the skin really numb beforehand. One of the other ways that we can make the treatment less painful, and when it's less painful and less discomfort, often that will also correlate with less chance of risk and less downtime associated with it. So I mentioned that we deliver energy in a controlled way. So think about we're looking down from the top of the skin and we're delivering all these little laser beam dots. Okay, so we can do up to 300 or 400 dots per square centimeter. So they're really tiny dots. Instead of delivering all the dots at once, where we get a heat that's really, so that heat's really close to this heat's really close to this heat. That's how we initially used to do it back, a decade ago. What we do now is we do what's called a controlled chaos technology. So we will deliver energy here, and then we'll come straight across and deliver energy here. So this is 1 square centimeter here, and this all happens like in a blink of an eye, in a split second. And as we deliver the energy here, that allows this part to cool down a little bit. So the skin never gets as hot as what it would have if we just delivered all of it at once. So that results in significantly less discomfort associated with the treatment. The other way that we've managed to reduce discomfort associated with the procedure is to manipulate the energy and power settings. So we can do 2 different things with that. Is we can do how much energy we deliver per pulse, and then we can also do how many milliseconds that power is delivered over. So you can see here, that's 0.35 milliseconds. The shorter the time frame, the less time we cook the skin, and those things have a relevance when it comes to pain and discomfort. So if we compare CO2 now to CO2 a decade ago, they're just chalk and cheese in terms of discomfort and downtime associated with the procedure. So while a lot of people hear CO2 and think, oh my God, I'm gonna have my face is gonna melt off for the next 2 to 4 weeks, there are settings that we can do that, but they're few and far between. We don't typically do that anymore because there is a more sensible, controlled way to deliver that energy. The next common concern that our patients have is the downtime and recovery. So people want to know, look, how long am I going to be out of action for? I've got to go into the office on Monday. Am I going to look like my face is peeling off on Monday? The beauty with these new technologies is that they're very predictable. So I can deliver a certain amount of energy in a certain number of density of spots in a certain width of delivery of the energy, that I know that you're going to have anywhere from 3 to 5 or 5 to 7 days downtime. So I can be pretty precise in terms of how much downtime I give you to really manage your expectations afterwards. So one of the things that I've mentioned earlier is that the fractional delivery of energy, that has significantly reduced the downtime associated with this treatment. And also not necessarily just the downtime, but the oozing and the bleeding and all those kind of things, they're really, really minimal now because of how we've done the fractional downtime. Also with the downtime is because we can be so predictable in how much downtime we give you, we can tailor the treatment based on the results you want and the downtime you're willing to tolerate. So if we do a gentle laser facial, you can have anywhere from 2 to 4 hours downtime. If we do really gentle settings, it'll give you a nice kind of a little bit of redness afterwards, but a real nice glow in the week or two following. Or we can do a moderate type of setting where you'll get anywhere from, let's say, 3 to 7 days of downtime. Now, when I say 3 to 7 days of downtime, I mean perhaps a little bit of oozing for 1 day, a little bit of swelling for up to 2 days, maybe some crusting for a day after that. So I would tell our patients, if you had the treatment done on Friday, you should be okay to go back to work on Monday, okay? Some people may be a little bit more cautious about going back to work because they're a little bit red or slightly a little bit flaky, in which case I think you'll find even the day after for those treatments to go back to work online. So if you're zooming in or something. Moving on to more intensive treatments, let's say you got one of our more intensive lasers, say you got the treatment done on Friday, maybe you go back to work on Wednesday, maybe Thursday if you have to be face-to-face in the office or customer facing. Or again, if you're online, it's not that difficult a procedure to recover from. So you could probably still work the day or two afterwards if you were comfortable, being at home on the computer or something. The other thing that we've mastered in the last couple of years is speeding the healing after the process. So we have LED light therapy that we suggest everyone does after the process. And what that does is it manipulates the mitochondria within the cells. It's something called photobiomodulation. And it allows those little powerhouses within the cell to work better and to heal better and to produce collagen more effectively. So we would recommend you do that in your healing period. That'll significantly speed your healing time. Similarly, we do things like we add exosomes to the skin, which are like messenger molecules for stem cells, which also help to rapidly improve your healing. There's another medication that I can't mention because of TGA guidelines that we also apply to the skin afterwards that can, in some cases, reduce your healing by 25%, which is quite effective. And you can speak to your contour clinic's doctor before doing the treatment to ask about what that may be. 3 is the risks and side effects associated with the procedure. Now, every medical procedure carries risks, and CO2 laser is no different to any other medical procedure. And it's important you select a clinic or a practitioner that has had the appropriate training and skills to be able to manage any of the complications that may arise. And even more importantly, prevent those complications from arising by delivering sensible, effective, and safe treatments. A few ways we've been able to manage some of the risks associated with these treatments is by education and training. Now at Contour Clinics, we have over 500 to 600 hours of live teaching every year. So our practitioners undergo rigorous qualification and requalification each year, and we also we're continuous learners here. We continuously update ourselves on the latest technologies and go to conferences all over the world to learn all of the best protocols to make our patients safe. The other thing is that this technology, the CO2 laser technology, has been around now for almost 60 years. So in those 60 years, there's been thousands of studies performed. There's been some really kind of big laser companies that have really invested in creating the most effective way and safe way to deliver energy. So there's no real surprises in this field anymore. All of the studies have been done. It's been around forever. There's lots of key opinion leaders and consensus opinions as to exactly what the safest way to deliver this energy is. So number 4 is a common concern is healing. So in the post-procedure period, what it's going to look like can be really daunting because you're getting some oozing and crusting and a little bit of bleeding. And on days 5 to 7, the itching can be quite intense as well, and the skin can feel really raw. So how we kind of combat that is that we have really clear, concise, easy aftercare to follow. So we send it to you via email, you can look it up online, and you can call us anytime for us to run you through the aftercare. We explain it pretty in detail as we're going through the consultation as well. We also offer complimentary follow-ups after you've had your CO2 laser, if you need to, just to make sure that there's nothing kind of serious going on, you don't have any signs of infection. We have a dedicated call center inside business hours to handle any of the concerns you may have with your treatment. And we also have doctors in every clinic as well. So we can escalate inside business hours. We'd probably have anywhere from 10 to 15 doctors on, all with experience in CO2 laser. They can help to answer any of your questions, and they can see you on very short, in an hour or two's notice. Outside of business hours, we have a 24/7 advice line with a real person online chat. And if there's something serious, it gets escalated to one of the senior doctors that are on call. We also have optional exosome therapy immediately post-treatment, and that helps to speed the healing, reduce some of the downtime associated with the treatment, and improve the results. The LED light is to kind of boost skin metabolism, rapidly improve healing, so that's also effective in terms of speeding your healing process. The fifth common concern is pigmentation and hyperpigmentation that can follow CO2 laser. Now, this is more common in those with darker skin types because they have more active melanocytes, so they're the cells that stimulate melanin or the pigment in the cells. And this is not super uncommon. You can get some pigment that follows trauma. And most of the time it's really mild and it lasts for a few weeks, if anything. Now, how we do things slightly different at contour clinics is we like to prep the skin prior to CO2 laser. So we do that to switch off your pigment producing cells prior to you having a CO2 laser treatment. And what that does is it significantly reduces the risk of that post-inflammatory hyperpigmentation. So that is a pigment that follows trauma. So if we use a really potent non-prescription tyrosinase inhibitor here at Contour Clinics. It's with something called 4NB. I can never say the full name of that, but it's in our brightening cream from Illume. And we put that on 2 to 4 weeks beforehand, twice a day before the procedure, to switch off those pigment producing cells. And that in and of itself, that cream can create a really beautiful brightening kind of clarity to the skin. And I'm going to show you here a really good before and after picture of a young lady that's had this skin treatment for 4 weeks. And you can see how beautiful her skin looks before and after here. The sixth most common concern is it safe for my skin type? So because CO2 lasers target water molecules within the skin, it makes it safe for all skin types. So although we have to have added care in looking after those really dark skin types. So if you look, and I'm going to put up a photo here of all the Fitzpatrick skin types. If you're 1, 2, or 3, you'll see here that they're lighter skin types. They're very safe skin types to treat with laser. As we get to the 4, 5, and 6 skin types, those skin types will require a little bit more care, a little bit longer time on the tyrosinase inhibitor, and some lower, more gentle settings as we're delivering the treatment. So the last common concern from patients is infection. So they worry about infection afterwards. Now, in most patients with healthy immune systems, infection rate is really a rare complication. Some of the older research quotes risks anywhere from 1 in 100 to 1 in 1,000, but that really depends on the intensity of the treatment. And some of these papers actually quote full field ablations rather than fractional delivery of the energy as we do these days in clinic. So the risk would probably be more closer to the 1 in 1,000 than the 1 in 100. Now, we really like to have close contact with you after the treatment, and we like to see that you're strictly adhering to our aftercare instructions. And we like to educate you on early warning signs to watch out for. We insist on all patients taking prophylactic antiviral medications prior to the treatment. This really reduces the risk of a HSV reactivation. So if you've had cold sores before, reactivating can cause a really significant infection if you get that. So basically universally across the world with CO2 lasers, it is necessary to take an antiviral tablet medication. So making sure that we adhere to all strict hygiene and safety protocols, and making sure that you do things like stay out of the sun and making sure that your skin is clean and you follow all of our aftercare really helps to keep you safe from these CO2 laser treatments. So they were the top 7 customer concerns as it relates to CO2 lasers.